Welcome to the Besties with Breasties podcast. Sarah Hall here. I am a certified health and wellness coach, athletic trainer, mom, and breast cancer survivor. I help women overcome their own mind drama to make mind shifts that open up the possibility for their most empowered and energetic life.
And I am Beth Wilmus, author, speaker, and founder of a human investment organization, otherwise known as a nonprofit, called Faith Through Fire. Our mission is to reduce the fear and anxiety that breast cancer patients feel and replace it with hope and a path toward thriving.
This podcast is about our experiences with breast cancer
and life after as young survivors and moms.
All right, so hi.
Hello.
That was very energetic.
I know, I'm excited.
We're always excited. Can we talk a minute about how much feedback we got regarding our last podcast episode on losing weight?
So much.
Oh my gosh.
Yes.
My phone was blowing up. My email was blowing up. Our little messages from our podcast listeners was blowing up.
The masses have spoken.
That's right. Yeah, I actually got a message from a gal who was saying that she had just left her 3-year follow-up appointment with our oncologist. And she goes, I was literally thinking about my weight and how much I've gained since treatment. And she's like, and then I go to my email and what is there except for your podcast on losing weight after breast cancer? So
It's a sign.
I know. So anyway, all that to say that we got so much feedback on it that we're doing a second episode, correct?
Yep, we are.
Yeah.
And we're bringing on a true expert.
Yes. Yes. We're going to be talking today to a certified health coach about weight loss after breast cancer. Her name is Dr. Delia Garcia. She is a board certified radiation oncologist. She practiced medicine for 30 years before adding health coaching to her practice in 2006. And she did that because excess weight is a significant risk factor for breast cancer. And she felt passionate about helping women avoid breast cancer and then helping them after they get it live a healthier life. So she actually, Dr. Garcia, retired from medicine to exclusively coach in 2011.
Yes. Oh, I love that she realizes the power of coaching.
Right.
Yeah.
Well, yeah. As a fellow, I bet you like that.
Yeah.
So we're going to talk to Dee about her journey from doctor to full-time health coach.
And then we're going to talk about why women gain so much weight after a breast cancer diagnosis.
And we'll end with how Dr. Garcia helps women achieve a healthy weight, where you can find her if you want a personal coach just to help you meet your health goals.
Yeah. But until we talk with her, let's go to our first sponsor.
Hair loss is consistently ranked as one of the most feared side effects of chemotherapy treatment. The emotional impact chemo hair loss can have on patients has been well documented. Scalp cooling is a simple treatment that can prevent hair loss caused by certain chemotherapy drugs. The use of scalp cooling is proven to be effective in preventing chemotherapy-induced alopecia and can result in people retaining much of their hair. Paxman is the global leader in scalp cooling. Their cold cap is scientifically proven to reduce hair loss during chemotherapy. If you are facing cancer treatment and concerned about losing your hair, ask your provider about scalp cooling and visit our website at www.coldcap.com. All right. Well, welcome, Dr. Garcia. Thank you for being here.
Thank you. It's my pleasure. I'm so excited to share what I know with your audience.
Oh my gosh, we are so excited to talk to you about, you have such good experience, I guess is what Sarah and I were saying offline before we started talking to you. It's just your career path and how you got to the point where you're coaching patients about their health is just so interesting. So for people who are listening, you're a radiation oncologist, right? What made you want to get into medicine?
Well, that is a wonderful question. And, we all have stuff from our past, right? That molds who we are going into our future or molds who we are, in the present time. So I grew up in a small town in Illinois, 1,800 people. My mother had an 8th grade education. She worked as a janitor at our local school, which was half a block away. So my parents, their goals for, myself and my 4 siblings were pretty low. You graduate from high school and you get a job and move on. But I had a high school teacher named Harry Hunt, Hunt. Harry was my biology, physics, and chemistry teacher in high school. And he took me under his wing, he and his wife, and started to ask me, what are you going to do after you finish high school? And I really had no clue. And so he said, you could do well in medicine.
Okay, so you knew you wanted to get into medicine and you spent some time, what was it, from 1984 to 1992, you were an associate professor at WashU School of Medicine here in St. Louis, right? Before you ventured into private practice?
I did my training here at Washington University. It was, one of the top programs in the country for oncology. And I was the only woman in the department. So it was a little scary at first. But yes, I thrived there. I had the most wonderful professors, the most wonderful training. And I stayed on the faculty for 7 years after I finished.
When did you decide to change? Because you incorporated health coaching into your practice. What were you seeing with patients that made you want to do that?
Over time, I started to see younger and younger women coming in with a diagnosis of breast cancer. So the usual, woman who's diagnosed with breast cancer is in her 50s or older. But I started to see women in their 40s, 30s, 20s. I even had a 17-year-old one day who came in with her mom and dad to discuss her breast cancer treatment options. And there is something not normal about a 17-year-old with breast cancer. It's not normal to see people in their 20s. However, when I thought about it, I thought, this is really no different than that pediatrician who is now seeing little children, 6 and 8 and 10-year-old children with type 2 diabetes in their practices. We used to call it adult onset diabetes because it used to occur in, people that were grandparents. And now we're seeing diabetes in these very young children. And why are we seeing that? Because of children are not eating healthily, they are overweight and obese, and so they're developing adult diseases. So the same thing with some women with breast cancer, not all of them, of course. So 15 years ago, I started incorporating a lifestyle program into my practice. And then 5 years after that, I left mainstream medicine to do health coaching full time. And that's what I do today. I work with, men, women, families, companies to create that vibrant health and add years to people's lives.
Can I ask you a question? This is for we get a lot of patients asking us to explain the difference between a regular MD, a functional medicine doctor, and a health coach. It seems like there's a lot of confusion around those different disciplines and how they're each different. Can you kind of illuminate us a little bit on your thoughts with that?
Yeah, a functional medicine physician, most of those are MDs, medical doctors, or a doctor of osteopathic medicine, which it would be a DO. And then for health coaching, really anyone can be a coach. You can have a registered dietitian, you can have a physician, you can have a nurse practitioner, and you can have that stay-at-home mom that knows a lot about, or maybe doesn't even know that much about health and wellness, but has the tools and has the time and the talent to guide a friend or a neighbor or a relative to better health and well-being. So a health coach, you don't have to be an MD.
Okay, interesting. But you specifically chose health coaching for what? Like, why did that draw you in?
Well, I chose health coaching because, again, I had this whole office full of patients that were very young, and I just became so attached to these young women. They would come in with their babies and their toddlers, and I knew that I had to help them with more than surgery, chemotherapy, and radiation. And, a really good friend of mine lost her mom when she was 11. And I just have witnessed how she has struggled. She had a 7-year-old sister and a 9-year-old sister, and the oldest one in the family was 16. And, my obsession was I need to get these women healthy so that they can do well and raise their own children, because it's not just breast cancer, right? It's hypertension, it's diabetes, it's heart disease, it's stroke, it's Alzheimer's. All of these diseases, the same thing that lowers the risk of breast cancer, that lowers the risk of a recurrence, that improves the survival of someone that already has a diagnosis of breast cancer. Those are the same things that will decrease the risk of heart disease and diabetes and Alzheimer's and all of those things. It's not any different.
So it sounds to me like you were kind of saying, you wanted to kind of gravitate away from the sick care model, right? Where you're just treating the illness and you're trying to get preventative care going so that these women would have a higher quality of life. Is that fair?
Yeah. Yes, that's fair. But the impotence for me to leave mainstream medicine and venture out as, a reinvented health coach was that one of the major hospital systems bought our medical practice, and overnight it became a corporate practice. So we went from a holistic place where we offered yoga and nutritional counseling and, mental health things and all kinds of different modalities besides the chemo, radiation, and surgery. We went from that to, the bottom line was, how much income can we produce? So,
which I think
it changes the culture.
It changes the culture, but also,
definitely.
I mean, it's so out of tune with what patients want. And I think, like, as breast cancer survivors, we're really just disillusioned with the fact that medical care is that sick care model and it's not encompassing the whole person. So it's fascinating to talk to somebody with your medical background who recognize
that also.
Right. Yeah. Sees that, recognize that, and then aim to try to rectify that. But it doesn't take much to undo all the work you put in, does it? I want to dive into why women gain so much weight during and after breast cancer. But before we do that, you guys want to do Boobs in the News?
Yes.
All right. Boobs in the News is a fun segment where we read funny tweets by real people or ridiculous news stories. Boobs in the News is brought to you by Pink Perfect, pink-perfect.com. Pink Perfect provides silicone prosthetic nipples for women who have undergone mastectomy and breast reconstruction with nipple removal. Visit pink-perfect.com and use promo code FaithThroughFire to receive $25 off your purchase.
Bibs in the news, bibs in the news, bibs in the news.
Okay, are you
lay it on me?
Okay. Okay. All right. This comes from Wired.
Okay.
Today's how-to: kill germs without being a complete idiot. What do you think? What do you think is going to happen?
How to kill germs without being a quick. I don't know. Is this like one of those morons that like drinks the hand sanitizer?
Oh, no.
Decides they want to bowel clean?
So this came from a headline, and the subhead on a Reuters story says, "People only zap wet sponges to kill germs. Readers have disastrous results when they try to sterilize dry ones."
What?
So apparently it goes on to talk about how all these people wrote into the article about, hey, you should put a huge disclaimer that you should have to wet your sponge before you put it in the microwave. Have you heard of people doing this?
No.
What? Okay, so a lot of people will put a wet sponge in the microwave and they'll microwave it for a bit because they think it kills bacteria.
Does that work?
And it might. I don't know. I don't do this.
Okay.
But they read this and apparently gave it a try themselves, but forgot to wet it.
Okay, so it got all hot and
so
went on
what
fire.
Happens was it started the microwave on fire. Just wanted you all to know that your article on microwaving sponges and scrubbers aroused my interest. However, when I put my sponge scrubber into the microwave, it caught fire, smoked up the house, and ruined my microwave and pissed me off. One correspondent wrote in an email. And then another person, first, the sponge is worthless after, so you have to throw it out instead of using it. And second, your entire house stinks like a burning fire for several hours. They clearly didn't read the directions. Somebody also wrote about, like, in response to these people, that they hadn't seen The Green Mile.
They hadn't seen The Green Mile.
Have you seen Green Mile?
Yeah, of course.
Okay, remember what the guy does?
John Coffey.
Yeah, the guy does to the guy who's getting electrocuted to be mean.
He doesn't wet the sponge.
The same thing. The same rules of science applied here.
Oh my gosh.
So,
have you ever caught your microwave on fire?
When I was younger, I put a
bread tie.
No.
That's how I did
What
it.
are you? I mean, I guess you know it's the Chinese takeout container.
Oh, yeah, with the metal.
Yeah, with
handle.
the metal handle in there, and that was when I was like learning.
Yeah.
Well, that's when
Learning
I learned
how to use
that
the microwave.
when you do that, small fire starts.
My mom and dad used to have loaves of bread in the freezer, you know, and then we'd defrost them. Well, I put it in the defroster for the microwave with the little tie on it.
Excellent.
Could saw some fireworks.
Yeah. I bet.
Okay, so
So the boobs are definitely the people who didn't follow the directions.
I think the boobs are the people that wrote that article that thought people were going to be smart enough to know this.
What?
Yeah.
No, the boobs are the people who didn't read the article.
No, you have to know how many idiots there are in the world and then cater
Oh my
and then
gosh.
adjust accordingly.
You're the person who's like, yeah, we should definitely put the warning on the Bengay that it only goes on your butt and not on your mouth.
Or the lady that didn't realize
Oh, I guess
coffee.
it's not Bengay. What do you?
I don't know.
Hemorrhoid cream.
That it doesn't go on your mouth, it only goes on your butt.
Yeah.
Oh. What about the lady?
Who's the comedian who's like, my mouth is so small.
What?
I ate this whole tube of hemorrhoid cream.
What? That's so gross. It's like the lady for McDonald's that sued McDonald's because the coffee was hot.
Yeah, exactly. I think the boobs are the people who didn't read.
I think the boobs are the people that do these products and then
All right,
don't realize that people are morons.
We will agree to disagree.
All right.
Yeah,
There's
that's
your
your
boobs.
boobs.
Bibs in the news, bibs in the news, bibs in the news.
All right, we are back. Dr. Garcia, I would love for you to talk actually. Why, because this is something that I struggle with myself, but why do women gain so much weight during a breast cancer diagnosis and after too?
A lot of women are going to be heavy before they even get breast cancer.
That is true. That's true.
I mean, and that we know that's a huge risk factor for breast cancer. So they're already heavy, or in yours, in my case, maybe they weren't, but then they gained a bunch of weight from.
Yeah.
I mean, I didn't gain weight from breast cancer treatment. I lost weight during breast cancer treatment, but then the hormone.
Not.
Yeah, you did not. You gained weight, but the hormone meds definitely made me gain weight. So,
Same.
So what's going on there, Dr. Garcia?
Well, first of all, the reason why being overweight or obese is a risk factor for breast cancer is that our own body fat stores estrogen, and that's the precursor for breast cancer. So in postmenopausal women, the biggest source of estrogen is their own body fat. And 80% of breast cancers are estrogen receptor positive. So they feed off of estrogen. So that's why we want to get to that healthier weight. But also the medications that are used after the main treatment is given, after surgery, chemo, and radiation, oftentimes women, again, with the hormone receptor positive cancers are put on medications such as tamoxifen. And many women gain weight with tamoxifen. You know, it may be 10 pounds, but it may be 30 pounds. So there it is.
I was surprised. So I was on an aromatase inhibitor for 5 years. And then we did some testing and they said, well, you're probably not likely to benefit from an additional 5 years. So I'm no longer on those. And the thing I was really excited about, besides getting rid of achy joints and all the other side effects that come with that, was I thought, oh, finally, this is where the 10 pounds that's been hanging out on my backside for the last 2 years is going to just drip off. Well, I got off in August and it is not just dripping off. And I'm wondering, is it because your body just needs time to adjust? Is it because I'm in permanent menopause now, that the drugs have driven me and the chemotherapy have driven me into permanent menopause? Is it because, I think I'm being healthy, but I just need to make better lifestyle choices? I mean, there's a lot of women that feel super frustrated, either because they feel like they're doing the right things, but not seeing the results, or maybe they don't know what those right things are. So how do you help women lose weight? What should they be really thinking about, if they find themselves in that situation? Because, I mean, I haven't met a breast cancer survivor yet that doesn't want to lose weight.
Yeah, well, metabolism changes. So when your metabolism slows down, and we think of ourselves like when we were in high school and, we could eat the pizza and the chocolate milkshake and the plate full of French fries and not gain an ounce. So metabolism changes over time. You mentioned the hormones, and, that certainly plays a factor as well. But oftentimes when people are trying to lose weight, they're doing the wrong thing. Like, for instance, they'll go all day long without eating, thinking, well, if I just eat once a day or maybe twice a day, then the weight will come off. Really, the science behind weight loss is if you eat a little something, about 100 calories or so every 2.5 to 3 hours, you're something that's nourishing your body. Maybe it's the hummus and the celery and carrot sticks, or it's the apple, so if you're eating a little something throughout the day, you're nourishing your body, and then your body will trust you, so that when you're eating a bigger meal, your salad for lunch or your lean protein and vegetables for your evening meal, it won't take those calories and store them into fat.
Well, before I want people to know where they can find you. Just in, if they want some help with their health goals, I want them to know where to find you. But before we do that, let's talk to our second sponsor.
Innsbrook Resort is a proud sponsor of the Faith Through Fire Respite House and the Besties with Breasties podcast. We know you work hard, but at Innsbrook, we also know you want to disconnect from what's stressing you out and reconnect with the important things in your life. Innsbrook makes it easy by offering lakefront living and vacationing less than 45 minutes from St. Louis. Vacation homes, golf, swimming, nature trails, fun events, and more. Take a drive and discover Innsbrook. Visit innsbrook-resort.com.
Okay, we are back. Dr. Garcia, there are lots of women that are seeking help. I think a lot of people, it appeals to them to have kind of a partner, right? An accountability partner, somebody that can educate them, tailor solutions that meet their health needs. That's everything you do. So where can patients find you if they want to reach out and get that free consultation?
Honestly, my favorite way to be contacted is by text. I do have email, but I have, like a lot of us, we get so many emails, and I'm always terrified that I'm going to miss an email. And I'm constantly in my email unsubscribing and then deleting, 200 emails at a time, and they just keep popping up. So I am never shy about sharing my mobile phone. It's 314-440-6449. And I would say if it's an initial contact, do not call, because I have notifications turned off for anybody that's not in my phone contacts. So if you text me and you say, hey, this is Susan, I'd like, some advice on, breast cancer or losing weight or, diabetes or whatever, then I know it's a legitimate call. And then we can go from there. Yes. So connection with me is easy.
Something else that I want everybody who's listening to know is that Dr. Garcia provided us with a really informative presentation that Sarah and I were actually listening to the other day that we thought would be really useful to patients. So if you want to watch that and learn a little bit more information, then I would encourage you to join our private online community. So that's faiththroughfire.mn.co. If you can ask to join, then you can go on there and we will have her presentation posted under our courses. And that way you can get more free content about what we've talked about today. So
thank you so much for being with us and sharing all of your knowledge and your experience and everything that you have shared with us today.
Yeah. And thank you for recognizing how important holistic health is in a woman's journey. And just, it's so needed and so many women want it. And we're just underserved in this area. So thanks for being an advocate. We really appreciate it.
Well, I'll tell you, it's not difficult. And it's so much easier than people think. The difficult part is there's so much conflicting information out there, and it's confusing. And there are people with agendas, like the agenda to maybe sell a boatload of supplements that we get from our food. And so my goal in life is to get people off prescription drugs, keep them off prescription drugs, and let their own body heal by the person adopting these simple lifestyle choices. So thank you so much for the invitation. And it's my pleasure.
Thank you so much, Dr. Garcia. Thank you for listening to the Besties with Breasties podcast. Leave us a voicemail or share your own experience on bestieswithbreastiespodcast.com. And don't forget to leave a 5-star review. This episode was hosted by Sarah Hall and Beth Wilmes, audio and production edits by Innovative Frequencies.